It's great to be here. It's great to be here with our panelists today, and I'll just give you just a little introduction to what we're going to talk about. So Kelvin talked about the challenges that we're facing right now in healthcare, and we want to just not just focus on the challenges. We want to talk about the future and solutions as well. So specifically, we want to talk about Utah and what some of these challenges mean to Utah. We are in a really interesting place in the world today in terms of healthcare. It's I think about it's the best of times and the worst of times in some ways. That it's we as a state, our population is growing rapidly, but it's also aging rapidly at the same time. And so that brings a rare combination of both our opportunity and urgency for us to address things like rising healthcare costs. Other things that may not be as apparent to many of you are workforce shortages. And specifically, I think one of the things that we're all concerned about is chronic disease and how we manage chronic diseases. But we think that Utah possesses a unique mix of innovation and our sense of community and our engagement that we have with our population and our educational approach and excellence. We think that Utah really is in a pivotal place to redefine the future of healthcare. And so we have today with us two people that are driving that and the future of what's going to happen here in this state. So I'll start with the introduction of Mark Ott. So Mark is the inaugural dean of the BYU School of Medicine. He leads the newly established BYU School of Medicine, focused on training compassionate, service-oriented physicians to meet Utah's growing need for primary care, rural medicine, and innovation in medical education. So we're very, very happy to have you here, Mark. Thank you. And then immediately to my right is Bob Carter. So Bob is the Chief Executive Officer of University of Utah Health and the Executive Vice President for Health Sciences at the University of Utah. Dr. Carter oversees one of the nation's top academic medical systems, and his background bridges neuroscience research, clinical research, and large-scale system leadership, positioning him to speak on healthcare delivery at scale. So thank you so much for joining us today. And we're just to kind of set the background, just want to talk specifically about Utah and Utah's demographics in the context of healthcare. So I mentioned that we have one of the fastest growing populations in the United States. I think we're on track to exceed 4 million people in the next 6 years. So from when I was young, I'm a native, born here in Utah. This is a big change from what we experienced just not that many years ago. We also are seeing that the number of Utahns that will be over 65 will double by 2040. And just think about that, when I was young, once again, I used to think 65 was really old. Today, 65 is not old. It's very young. But 20% of our population is going to be over 65 in just the next few years. And so thinking about what impact that has on our healthcare and we do actually a very good job. We only spend, I think, 5% annually. Growth has been 5% annually, which is a lot lower than most states, but it still has an impact on us. And certainly, we talked about chronic diseases like heart disease, diabetes, obesity, particularly, I think, putting pressure on our healthcare system because our systems are really good at taking care of acute things. I just had an appendicitis. We were just talking backstage. You know, you have something acute, you go in, you have the surgery, you get sent home, everything's great, right? That's, you know, with chronic conditions, it's a little different of how we deal with that and the strain that puts on our healthcare system. And then the last thing really is our workforce shortage. And this is probably something that most of you don't appreciate, but certainly both of you think about it a lot, that we have a shortfall of more than 1,200 physicians, which is just crazy to think about that based off of our growth and the projections, and 3,000 nurses by 2030. Thinking about the rural and geriatric care is probably where it's hit the hardest. And so we want to talk about not just the problems, but some of the solutions. So to start with, maybe I can ask Bob, I'll start with you. When you think about the future of healthcare in Utah, what are the top two things that you think define the next decade of what's going to shape what the future of healthcare looks like?
No, thank you, Dave. It's great to be here with you and Mark, and really enjoy the opportunity. You know, when I think about the future, you highlighted one issue, which is our demographics. You know, we have this aging population. I think our title of our session, that Silver Tsunami. So with our population aging, we will have an increase in complexity of care. It's just natural as we get older, those kinds of issues will come up. So that complexity that comes, and then also at the same time, a challenge on affordability. So that is going to be a bit of a collision there between how we think about preparing people for healthy aging, trying to improve the way we age, and also trying to control costs and making sure that we have a sense of how to manage at a population scale our health. And that probably means thinking about the behaviors that we have earlier in life a little differently, and how we bring care into the kind of at-home health concept and what we're doing even before we get sick and have that appendicitis.
Yeah, I think that's exactly right. So Mark, I think, you know, thinking about your position now, and before you joined Brigham Young University, you were at Intermountain Healthcare, the largest healthcare provider in the state. So you've seen a lot of the impact of some of these challenges and things how they've been changing. But thinking about the training of physicians, if we're going to make this transition, how we train people in your new medical school and what you're thinking about, how does that impact the curriculum and how doctors approach the way they get trained? If we're going to do more of primary prevention, more at home type of medicine, how do we support that, and what are you thinking about with training of the new generation of physicians?
You know, Dave, I think that we're really good at training people to work in hospitals. We're very good at training them to work in clinics, and we give them almost no training about how to deliver care at home. And I think that the future of medicine, especially in Utah, where we have committed family and friends who are willing to care for loved ones, as opposed to putting them in institutions and hospitals and things like that, is we need to teach the physicians how to deliver care outside of the hospitals and clinics. That is always going to be the most effective place to deliver it in terms of cost, but it's also the place where they get incredible support. I had, one of the things in what I did in surgery is I did everything I could to never send somebody to a skilled nursing facility, not because there weren't good skilled nursing facilities, but you cannot replace trust and love. And I can take anybody who cares about a person, and I can teach them the things they needed to know to help that person get over a surgery or get ready for a surgery. And so we need to focus on that aspect of healthcare.
So Bob, how do we change the perspective of people owning their own health care versus just saying, well, I'm just going to go to the doctor and have him take care of us? How do we try to push that change? And how does that happen? You know, we can do it from the doctor side of things, but it seems like it needs to be kind of a cultural change that needs to happen. How do we support those types of changes?
It's interesting, Dave, that when you think about this, all of us have probably spent a little time with ChatGPT or AI models, and what are we doing? And when we do that, we're really seeking information. We're trying to get information. And so how can we, in the healthcare system and in the educational environment, create an easier way for patients to access information that they want to study on their own, that they want to become involved. And how amazing would it be for a patient to have essentially prepped themselves before they actually interact with the physician and have quite a bit of knowledge about their condition and have asked already questions. But the key is the trusted source of information. How do we make it so that that information is highly reliable when we provide that type of access? And so I do think there are new educational paradigms that we can seek out, putting tools in the hands of our patients. And that's one thing that I think all of us in the educational environment are looking at and thinking about.
No, I think that's very important, and I know we're similar ages, and you grew up in a similar era, and I know that you guys have witnessed in your interaction with patients a big change that's happened with the advent of the internet, where patients walk in with a stack of paper that they printed off the internet and said, "Doc, I know what's wrong with me, fix me," and I think a lot of physicians that was an annoyance for them, and you're like, yeah, sure, Google told you what was wrong, or WebMD, but I really like the idea of we need to embrace that and help people find trusted sources of information so people can own their own healthcare in a different way than I think they've done in the past. So Mark, when you're thinking about those types of things with this brand new, the nice thing about having a brand new medical school is you don't have any historical things that, just obviously your own biases and the
Right.
bias of your faculty, but you can set a whole new curriculum. How are you thinking about those types of gaps and how you're going to fill those in the training of new physicians?
Well, I think it's a commitment, not just by medical schools and residencies and those type of training places, but it's also the community. How wonderful would it be if we spent as much time with our sons and daughters when they were in junior high and high school, teaching them and spending as much time and resources as we do to help them become a good football player or a great debater or something in drama. As parents, we put a lot of effort into that, and yet as a community, we don't teach them anything about healthcare until all of a sudden they have to buy insurance, when they're 26. And so part of it is the community saying, we value that, and we want to put resources into our children understanding healthcare. And we might want to help them understand finance and other things too. But and then from the physician side, our physicians have to be able to embrace the resources that will make them better, which would be artificial intelligence and all kinds of other tools that would allow them to have the information, the vast amount of information they need right at the point of contact with a patient. We still need somebody to examine and to be able to think through what the possibilities are, but none of us can hold all that information in our heads.
Yeah, no, it's fascinating. I was trained, we were just talking about a little bit about our background in training, and I was trained by one of the great medical oncologists in history, and he told me when he was a young doctor, he probably knew 90% of everything that you could know about cancer, and I don't think there's anyone that can know that in their own head. In neurosurgery or in general surgery, we just made so many new advances, and we need to embrace technology as an augmentation to what we do, because we can't have that kind of expansive knowledge, and we need to embrace that we have tools that can help us fill those gaps, and I look forward to the future of how technology is really going to change and how we adapt those, and we'll talk about that here in a minute. But I wanted to just touch on this idea of once again having another medical school in this state, and I pointed out the outset is we already have a shortage of doctors, and so I think everybody should realize there's not a competition here between that. This is actually a really collaborative situation for both the University of Utah and BYU's new medical school. So what innovations are you guys working on together, especially with one of the things that I think I'm concerned about is the residencies here as well, because in training you obviously go to medical school, then you go to your residency or fellowship, but you tend to end up maybe where you finished your terminal training, and so having more access to different residency programs and expanded our residency education. What are we doing along those lines, Bob? Is that's something that we're working on?
That's a great question, and we have some data that shows that if you do medical school in a given state, you've got about a 45% chance of staying for your permanent life career in that state. But if you do medical school and residency together, that might push up into the 80% range. So if we can create a pipeline from medical school to the actual graduate medical education training. And so, for example, one of the things that I hope that we can do together will be to develop opportunities for this pipeline directly from undergraduate medical education into graduate medical education. And we're starting to do some of the foundational work for that. This last year, the legislature funded 10 additional slots in the University of Utah Medical School for a southern regional medical campus. So this is focused on Washington County. Students actually do their first year in Salt Lake, but then they do their subsequent years in Washington County with the idea that they would slot into opportunity and training opportunities in the Intermountain facilities that are in Washington County. And I think this just opens up a whole ecosystem of training opportunities and collaborations. And I know Mark and I have talked about how we might push ahead in that.
Right.
Yeah, Mark, do you want to comment on that as well?
Yeah, Utah is very under-resourced for residencies, and the University of Utah has borne the lion's share of that responsibility, and it's an expensive endeavor. And they do a great job. Their residencies turn out incredible physicians, but there needs to be a gigantic expansion in multiple specialties, especially in the primary care area, because that's where the greatest need is. But we have needs in all the areas. And again, the sons and daughters who grow up here would love to be able to do their training here as well, and of course their parents love to keep them here if they can.
Absolutely, yeah.
Just to put a little fine point on it, Dave, if you look at the statistics, this is a regional problem. So Utah and Idaho hit at number 50 and number 49 in density of primary care physicians per 100,000 population. So we need to think about this broadly across the Mountain West. And it is an opportunity for us.
Right.
Yeah, I think that and to me, that's the exciting part about it. Every challenge has an opportunity associated with it, right? To say, we have an opportunity to do something that can have a huge impact. I want to transition to talk a little bit about something that everybody is concerned about, and that's the cost of healthcare. I think one of the things about Utah is we have a very cost-efficient healthcare market relative to most markets in the United States, but even with that, saying that, our costs are climbing, and we just went through 40 plus days of a government shutdown that at least at its face was focused on the idea of being able to continue to provide subsidies for affordable health care, and so it is something that is, I think, top of mind for a lot of people. So I guess from your perspective, and you don't have a magic wand to fix all these problems, obviously, but in your position, what do you think about, Bob, and I'll start with you, just thinking about how do we preserve affordability for Utah families while maintaining a high quality of care? And are those two things mutually exclusive, or can we do both of those?
I think we can do both, but it will require creativity. Mark and I together have both been on that kind of inpatient, acute care, surgical type practice. But as leaders, I think we're all thinking about population health and all of the work that needs to be done before you really get sick, and to try to minimize that. So when we look at population health data, we think that there are ways that we can have interventions that occur in the outpatient setting, lower cost settings, that will improve our ability to deliver that value per dollar that we want. And part of that means creatively thinking about, expansion of care at the top of license. So our nurse practitioners, our physician assistants, can they work at top of license to then leverage the expertise of other healthcare providers? That's one element of it. Also thinking about insights into biomarkers early in life. If an individual gets an early signal in their 30s about cholesterol or other elements that could have a strong impact 20, 30 years later, can we have the information to intervene at that earliest phase? And I credit to our health systems in the state of Utah for the work they've done on this.
Yeah.
I mean, you just returned from Abu Dhabi, where you were telling us that 6 million people, every citizen has had their genome sequenced. And that's an incredible resource. How wonderful would it be if in high school we could let our sons and daughters know that this is your profile. These are the things that you should be aware of. You have a higher risk of addiction. You have a higher risk of coronary artery disease. You have a profile for cancer. If we could get them to start early in life to understand how they could modify those risks or screen for those risks, we could take a gigantic number of people who needlessly suffer from disease and prevent or treat it early when it's easy to treat. That would be a great thing to be known for. I think Utah could do it. I don't think other states would have the resources and the willpower to do it. This state has the size and all those things. We could do that if we wanted to as a citizenship group.
No, I think that's very exciting, and I think speaking to this community here, Utah is home to remarkable innovation and a lot of entrepreneurial spirit in our population, and I think that one of the things that I think we can do better is work closer together between these guys out here and our institutions that are really on the front lines of facing the healthcare issues. Because sometimes what happens, and I can speak by experience and by my own faults as well, that as an innovator and a scientist, you have an idea of what a problem is, but if you don't have a connection to the people that are actually really dealing with that problem, sometimes there's a gap between the real world application and what the person working on innovation really is. And so with new opportunities that we just talked about and an openness, and I mean, these guys are the leaders here. So they're leading our two largest institutions that are focused on healthcare and have just said on record here that they are open to innovations. They're looking for new ways to try to bring some of these ideas to their patients and to their doctors. So what role do you guys see with artificial intelligence and digital health, and how we can take some of the innovation that's happening and weave it into what's going on the academic side of things, and how could we do a better job on that? Bob, do you want to start with that one?
Yeah, sure. And I'm a relatively newcomer to Utah, although I was born here and did college here. I was away for many years and just came back this last year. And one of the things that really caught my attention was the work that's been collaborative in nature on the Utah Population Database. So this database, which probably many of you have heard of, integrates a variety of different data sources from many different health systems here in the state. And think about what Mark just said about sequencing individuals and having that genetic data. Well, Dave, I know that one of the things that your team has worked on is how do you do discovery in a database like that? So that brings the entrepreneurial aspect of our innovation community in biotech into a collaborative effort. And this is very dependent on infrastructure. So coming together, state support, health system support, training the right type of young student who can capture that information. This example is just one of many that I hope that we can do through collaboration. And it'll allow us to create areas, secure data areas where entrepreneurs can come in and say, I can explore data sets in a protected, confidential way that meets all regulatory requirements, but opens up our opportunities for discovery. And we could talk a lot about the discovery side of it. It's fun.
Absolutely. Mark, do you want to comment on that as well?
Yeah, I think it's important that we always capture the data. Yeah. The data is so powerful for figuring out what went well and what didn't. And, when we moved out of the paper record into the electronic medical record, that, to be honest, was a gigantic step forward in healthcare. For the first time, we could capture all kinds of data that was just lost before. And then somebody with the right resources and abilities and computing ability to power could go and analyze that data and find where we were making mistakes. And while it creates other burdens to have to do things in a fashion that isn't as fast as what you might have been used to. When we moved into an electronic medical record at Intermountain Healthcare, I immediately saw the benefit to my patients. I stopped missing things because the record would remind me that this patient has 6 problems instead of the one that I was focused on.
Yeah.
And so we need to always be capturing every facet of every encounter with people in a healthcare situation. And if we do that, the ability to fix it becomes really limitless.
Yeah. So I think, from my perspective, I'm just excited about the possibilities of how we can work together and we can tap into all these guys out here that are interested in new innovations. And one of the things in Utah, there's a renewed enthusiasm for the sport of hockey because we have a professional hockey team here. And one of the concepts in hockey is you don't skate to where the puck is, you skate to where the puck's going to be. And so as we look to the future, and trying, not solving the problems today, but solving the problems of the future. We talked a little bit about how our aging population and how older, more medically complex patients put a strain on our system. And you talked about innovations in home-based or community-based care. Mark, can you tell us what are you seeing in terms of what gives you hope about how we can deliver that type of solution to those complex problems?
So we're fortunate. Again, I think this is the strength of Utah. We have a very strong family and friends network, and it's not just ascribed to one religious group or anything. The people that live in Utah care about each other, and so every time we can deliver care in a home by somebody who loves or cares about that person, be they family or friend, we're going to get great care. And we need the electronics, we need the digital connections. My mother is like internet terrified, and she lives in a house that has no internet, but we're able to deliver great care for the things that she needs at age 85 because we have some technology that enables my brothers and sisters and I to do this. And I think that's what we should be very good at in Utah.
Yeah. So Bob, speaking to the entrepreneurs out here, what would you see as areas that they could focus on of new innovations that could really enable some of these types of changes?
Great question. We have this competition that we do at the University of Utah called Bench to Bedside, which is open to undergraduates from all over the state and even out of state. We had great representation from BYU, University of Utah, and many of the other wonderful universities here in Utah. And when you look at the ideas that are coming out of that group in terms of wearables, the ability to monitor at home, to have a sense of care delivery, telehealth, the ability to kind of have expertise come out into rural and frontier areas. The ideas that are coming out of that group are amazing. And so these are young people who are already seeing the future, particularly as it relates to digital, AI, et cetera. I think if we can build this ecosystem of individuals who are interested in Utah as a place of forward-thinking health, this will benefit our entire state. It'll benefit us economically. It'll benefit us from the resources available to the family and friends network that Mark is talking about. We are coming up on a sizable inpatient capacity crunch in the state. No matter how many hospitals we build, we can't fit everybody in our old model into inpatient beds. So we need to think about, what does a hospital at home look like? And how do we support it and make it safe? And that is something I know that all of us in health are thinking about right now.
So that's, I guess that's a good cue for everybody out there listening and thinking about places to innovate for the future. That's an interesting concept, a hospital at home, that how do we enable using technology to provide care in a different setting, because the future is very clear that we are not going to have the hospital capacity. We do have a crunch of being able to have access to this traditional type of hospital beds. Mark,
Yeah, I think the other thing too is that hospitals and clinics, we all know you have to schedule, right? You have to go when it works for them. Whereas at home, you have the ability to make it work for the person and their family. And Bob was telling a story beforehand. I think it just completely epitomizes this need that he had to retrieve a ring that had fallen down a vent. And he was able to get the resource he needed almost instantaneously to retrieve that for his son, who was otherwise going to have a problem with his wedding coming up.
No, it's incredible. The things that, just thinking about how we can leverage the distribution networks. I mean, Amazon has same-day delivery for so many things. And, thinking about how you can leverage that type of capacity to enable this type of home hospital type of, or home clinic type of environment. And it's doable like now. We could actually do it.
Those companies succeed because they can deliver faster than you can actually go to the store in some instances.
Yeah, no, exactly. So I think, Bob, you mentioned a little bit about, that there may be some challenges on the public side of things, the government side of things. Once again, we don't have a magic wand to wave and say, we're going to fix things. But if you could propose to say, what's a single policy or systemic change that we could make that would have a big impact on our healthcare readiness? What's something you could think of that you could propose that we could push that could really have a big change for us?
I mean, there are a couple of things I could think of. If you look at some states that have made major investments in health, Texas has a very interesting program, for example, where if you're in Texas and in certain subdomains of biotech, if you bring your company to the state, there is state-based resources for that company. So if the CEO is located in the state and you're launching your firm, you can actually tap into non-dilutive funding to get your ball rolling. So kind of the concept that the state as an accelerator or catalyst is a powerful one. It doesn't mean that the state has to do operating costs forever, but rather just that initial investment phase to get the ball rolling. And then on the other side, I think, again, tapping into what Mark and I have been talking about, this collaborative spirit. Can we create the compacts where we agree, for example, for our students? We've got a new resource coming on, a new medical school. Can students from different medical schools rotate and have cross-fertilization of ideas? Can we create compacts for data sharing? And making it a Utah, basically a Utah vision, as opposed to a single institution vision for how we push out innovation, becoming known as the Utah Biotech Center of the world, really. So.
Well, I know that most people in this audience would be 100% behind that. I think that would be very exciting. Mark, do you have something that you could think of on the policy side that you could, if you could, have a wish granted, what would you change to make a difference for the healthcare system?
Yeah, you just said it. I mean, the people in this room are educated. They understand the pros and the cons of all that's going on in life sciences and in the biotech industry and in healthcare. But our citizens don't have that same level of knowledge. If I could wave a wand, I would want the state to invest in helping our citizens, particularly the ones that are growing up, to understand what healthcare and biotech can do together and what it can't do. We need the citizens to say, we want to do this, and we're willing to put our resources there, and then the political leaders, of course, would follow that. But as long as we have ignorance, we have problems.
Yeah, I think that's right. Well, we're about out of time. I think to just wrap things up, I want to end on a positive note, and I think, Mark, we'll start with you. What gives you the most hope about Utah's healthcare future? What do you see, and you think in 20 years from now, you're obviously playing a role in that right now. What do you see success looking like in 20 years that gives you hope for the future?
So we fortunately start on the high ground, right? We have a healthy population, we have a good economy, we have all the things that you need to succeed in healthcare outcomes. But we should never give that up. And in fact, our goal is not just to make sure that the citizens in this region are healthy, but to demonstrate for the world what can be achieved if we as a group of Utahns and Intermountain West people come together and say, we value this and we're going to make it a priority. If we do that, we will be legendary in helping healthcare become what it could be.
No, that's awesome. So Bob, on the same lines, what legacy do you hope that your institution leaves on healthcare in Utah? When you think about University of Utah Health, what legacy do you see that you want people to think about in the future?
I love Mark's comment about legendary in the sense of I really think Utah is at an inflection point. As a new Utahn, so what have I perceived as I've come here? incredible human resources. We have the people to make this happen. We have all the foundational strength. We've got these incredible healthcare systems. We've got the data sources. We have the biotech community. We can make this happen. So I would love 20 years out, 30 years out, 50 years out, that we look back and we say, Utah in that era really made the right choices to create this inflection point for our state. And if we look 50 years down the road and think about what our state, look across this valley, I would love to see those biotech clusters surrounded by a healthy population taking advantage of place, which is this incredible, beautiful, natural, wonderful outdoors that we have here. And just thinking about this is something special that we've created together.
No, I think that's wonderful. That's a great place for us to end. Utah has a history of tackling big challenges. Just the pioneer history of getting here and establishing this community and the innovation, the faith, the collaboration that went into that. I think that persists today, and I think we do have a shared vision and commitment to improve people's lives. And I'm excited with leaders like you guys helping to drive the future. I think our future is bright. And hopefully, this spurred some thoughts with people out there in the audience thinking about new things that we can innovate and ways that we can bring this future of healthcare, make it a reality for everybody. So thank you so much. Thank you for being here, and appreciate the discussion.